Hi everybody, I'm Dr. Terence Tan from Halley Body Slimming Clinic and Halley Medical Aesthetics. So today I want to talk about a topic that is quite frequently discussed when we see our patients in our clinic who desire weight loss. And that is beverages and specifically milk. We always tell people that in order to lose weight, we need to make sure that we consume less than what we use. Most people who are of a normal size, they perhaps need about 2,000 to 2,000 calories a day. A lot of times when we have maybe about 3 full meals a day, even without snacks and beverages, we already hit our limit. So in order to get to a lower hanging fruits, we always tell people that, hey, let's look at beverages, because beverages are things which are a bit more discretionary, or rather, something that we do not need to eat. So sometimes when we are hungry, we'll have to eat. But a lot of times we can choose our beverages, and it's not so much about hunger, it's more about choice. Now, a lot of us do not have a lot of sugary drinks. I think that milk consumption is actually quite substantial in most people. A lot of people do not know, but there's actually a lot of calories in milk. So for example, full cream milk, in this case, is probably about 72 calories per 100 mils. Okay, so what does that mean? It's hard for us to determine what's 100 mils. So I'll just try to use maybe a grande latte that you can buy from any major coffee chain as a proxy for how much calories you're going to consume when you have a cup of milk. So in a grande latte, there's about 470 mils in the cup. So when we translate this full-fat milk to a grande latte, we'll have maybe about 340 calories, and that is a lot. So let's say you need about 2,000 calories a day, 340 calories will certainly bust your limit. So we know that full-fat milk is high in calories. So a lot of people then would go on to what we have here, which is oat milk, skim milk, and almond milk. So these are either good substitutes for milk or some form of altered milk like skim milk, whereby the milk fats have been removed. So the next lower calorie milk product will be oat milk, and in this case we have got about 46 calories per 100 mils, and that translates to about 218 calories in a cup of grande latte. So that's still quite a lot of calories. That's probably about half a healthy meal. And if you were to want to cut down the calories a little bit more, you can consider skim milk, and skim milk has got about 32 calories per 100 mils. And in terms of the amount of calories, if you put this in a grande latte, it would be about 151 calories, slightly less than half a full meal. Still substantial, but certainly less. And last, we have almond milk. So in this case, this almond milk that we have chosen is fairly low in calories. It's got about 18 calories per 100 mils and only about 85 calories in a grande latte equivalent, like we said just now. So that's about 1/4 of a healthy meal. So between the three, I would choose almond milk for the lowest number of calories. Now, we have this concept that we teach to our patients to eat with your eyes open and not with your eyes closed. So it's not that we can't have a full-fat milk, but make sure that if you don't have the full-fat milk, either in terms of coffee, teas, or by itself, please know the amount of calories that you are actually consuming. Turn and have a good look at the nutritional content which is present in the packaging. Then taste and see whether it's really worth your calories. Okay, so if you were to go from a higher fat content beverage to a lower fat content beverage, there will be a difference in terms of taste. So you should then see what is the beverage substitute that feels good to you, that tastes good to you, and choose the one probably with the lowest number of calories. Yeah. So drink milk with your eyes open, not with your eyes closed. If you think it is worth your calories, please do it in moderation. This is Dr. Terence Tan signing out. Have a good day, and I hope everybody is having a good time. Bye bye.